Hi and welcome to Let's Talk. Dr. P Haridas has been providing exceptional service to the society for more than 4 decades. First as a leading surgeon in Kerala and since 2000 as an entrepreneur, a socially committed entrepreneur running a multidisciplinary hospital, Lords in Trivandrum. Today we have with us Dr. P Haridas. Let's talk. In a place like Trivandrum that has numerous multi-speciality hospitals, what is the Lord's advantage? How do you stand out?
That's a very good question. I have to think really. We are also a multi-speciality rather than multidisciplinary hospital like many other hospitals in Trivandrum. Although the size of the hospital is not as big as many of them, it is not the size that matters. What you exactly do within the available size, that's the most important. That is where we are different from other hospitals. And we are one of the pioneers in minimally invasive surgery. That is surgery of the 21st century. We very seldom do open surgeries. And that is surgery of the past. We do the present day surgery. That way, we are definitely different from other hospitals in Trivandrum.
Okay, so that would be your
that is
key
our,
advantage.
Yeah.
Okay. What are the benefits of minimally invasive surgery?
Oh, minimally invasive surgery is done through tiny holes, 3 or 4 tiny holes in the tummy. Okay. Suppose an actress comes to you, she has got appendicitis. I had to operate on one of the film actresses when I was an assistant professor in the medical college, long back in the early 80s. Okay. They had flown from Madras, came to my hospital, I was in the medical college. She had an appendicectomy done through an open wound. Okay. That gives a big long scar for the patient, maybe 4 centimeter, 6 centimeter, or even 8 centimeter. Today, what we do is somebody with an appendicectomy, 2 tiny holes or 3 tiny holes, we do an appendicectomy. And somebody who doesn't want a scar at all, we place a device in the umbilicus. I do a single port appendicectomy. There won't be any scar at all. Through the device, the camera, the telescope, and the operating instruments go. I need only 3 openings. So that is minimally invasive. The advantages are, everything is advantage. Less pain, no scar. You can eat next day. You can go home after an appendicectomy, maybe same evening or next day. Absolutely, everything is an advantage. The patient comfort is amazing. Okay. The problem we have, what is the problem we have? We don't have, the technology is advanced, but we don't have the so-called technicians or the surgeons who are competent to do this. That's the problem. So that is where we excel. And here we have single port surgery, laparoscopic surgery for all hernias, all abdominal procedures. We have laparoscopic surgery. We have radiofrequency ablation for varicose veins. We have stapler surgery for piles. There is no wound outside. There is no recurrence. There is no pain. Okay. Then one of the latest we do is WAFT, a procedure called WAFT, Video Assisted Anal Fistula Treatment. Anal fistula is notorious for recurrence. And this is the latest procedure for anal fistula. This is the only center right now in Kerala to do anal fistula treatment using endoscope, video assisted. Wow.
But Lords is also a training center for laparoscopic surgery.
Yes, yes, yeah.
So tell us a bit about the training facilities available here.
Training facilities, we have all the facilities available. Those who want to come in. Right now there are 2 doctors come from, one from Calicut, Dr. Anna Mani, and then another doctor from Pariyaram. 2 trainees with me right now.
Okay.
And whenever they come, I give training without any charges at all, and free training. And we give them what they want as well, like their food and things like that, we take care. We give free training. The purpose is that the patients at large, the public at large, they must benefit in the long term. So I don't mind training any surgeon for that matter.
You are a much sought after surgeon with more than 4 decades of experience.
Absolutely, yes. Yeah.
So what are some of the major changes that you've seen in the approach towards surgery? You talked about minimally invasive surgeries. In the approach towards surgery, what are the innovations or what are the changes that you have seen over these years?
Right. I could see both ends actually. I started off in the 1970s, and in the 80s probably was the best time in traditional surgery. 70s, 80s, the best part of traditional surgery I've been there. And from the beginning of minimally invasive surgery, I've been through. The advantages, probably not many will get that, and I am doing almost everything in minimally invasive surgery as of today, including bariatric surgery. So the changes taking place in medical field, especially in surgery, is technological advancement. You cannot even catch up. Before you close and open your eyes, there is some change already has come. So that's the way it is progressing. So surgeons will have to run. You don't have time to sit. They have to run to catch up the emerging technology. Now the robotic surgery on your doorstep, and not even 1% of surgeons in the country or in Kerala have not picked up even the minimally invasive surgery, leave alone robotic. Robotic is already there.
Okay.
So that's the way it is going, and people have to know. The public are probably aware more than the people in the medical field, I think.
You're also known for your expertise in liver resection.
Yes.
So tell us a little bit about that procedure.
Liver surgery, in the YouTube I have given my old liver resections actually, if you watch. That is liver surgery in the 1980s in Kerala. While I was an assistant professor in the Trivandrum Medical College, I started off extensive resections of liver for carcinoma, cancer liver, hepatocellular carcinoma. That is the main indication. And also for secondaries when they are single. Right now, I have a patient who has already undergone a right lobectomy, extended right lobectomy. She had a large tumor of the right lobe of the liver that was resected. She is a 44-year-old female from Maldives. Come to me with weight loss and swelling in the abdomen. She is recovering very fast.
You talked about obesity.
Yeah.
Obesity is a major lifestyle disorder of today. Are there a lot of takers for weight loss surgeries?
Obesity is one of the dreadful diseases. Not many realize this. It's a killer disease. It is deadlier than terrorism. More people die of obesity than terrorism. So obesity is the root cause of probably diabetes, hypertension, heart disease, back pain, acid reflux, sleep apnea, snoring, infertility in girls and ladies, sexual dysfunction, joint pains, you name anything.
All be traced to obesity.
All the dreadful complications of obesity. When we say obesity, someone is obese, when the BMI crosses 25. Between 25 and 30 we take it as overweight. When it crosses 30 BMI, it is obesity. When it crosses 40, we call it morbid obesity. When it crosses 50, it is super obesity. In fact, I had a lady just finished a major operation 10 days ago, just come for review. She had already lost 20 kilos in 15 days.
Okay.
And she was super obese. Her BMI was 51. And we get a lot of patients coming in. People are not aware. And the physicians especially, and the surgeons and doctors and media must make awareness and the dangers of obesity.
What are the risks associated with surgery, weight loss surgery?
The risk is very, very limited.
Okay.
Touch wood, fortunately for me, I've been doing quite a lot of them. And in 10 days, last week, I did 4 mini gastric bypass.
Okay.
That is one of the recent advances in bariatric surgery, mini gastric bypass, where you refashion the stomach, make the stomach smaller, then bypass about 150 centimeters of the upper jejunum, the small bowel where most of the food materials are absorbed. That is bypassed and connected to the designed stomach, and thereby we reduce the quantity as well as reduce absorption. Very effective for super obese patients. When you ask me about the long-term complications, probably they have a little protein loss, little vitamin loss, little calcium loss that can be easily replaced.
You have worked in places outside the country.
Obviously, yes.
Yeah. So what are some of the best patient care practices that we need to adopt?
I've worked in different countries, but you can adapt patient care in any country for that matter. You know your requirement. Just like what you would have liked to get from the doctor, from the nurse. When you are a patient, just think about it and you try to provide the best possible. That is what it is all about.
Okay.
The patient care depends on the doctor and the nurse, nursing services. It's very important. Suppose the patient is in pain, middle of the night, the doctor may not be there, but the nurse available must be able to relieve the pain. She must communicate with the doctor and give adequate sedation. You must take care of their diet, exercise, even when they are patient, even after operation. So you can design, if you are a reasonably good person, good surgeon, I'm sure that is not a problem. Any country should follow the same thing.
Okay.
Just because somebody is in America, that doesn't mean only those patients get the best care. Every patient must get the same care.
You have a nursing hospital, a nursing college along with your hospital.
We have a school of nursing, yes.
Yeah. How many years have you been running this?
10 years now. Yeah.
Okay. So do you source a lot of your nurses from
Most of them, yeah. When they pass out, we try to accommodate as many as possible. Not always possible, but we try and... but the nurses' training is poor these days in our country. Very poor training.
Okay.
That's one of the problems I'm worried about.
What are some of the quality and hygiene standards that are followed in Lord's Hospital?
We try to maintain definitely neat atmosphere in our... Because I being a surgeon, I talk about hygiene and meticulous way of handling things. Because even when you prick with a needle, outside the bottle, the outer side of the bottle will contain many organisms. You stick a needle in, that might take a lot of bacteria inside. And many people do not know, even doctors. And today morning I was telling to one of the nurses in the CCU, our critical care, where my liver surgery patient was resting. So I am very keen about, but you know, you cannot be there every time. But you train them, and definitely if you are at it, you can achieve it.
What are some of the corporate social responsibility initiatives of Lord's Hospital?
do quite a lot of, and probably this is the only hospital where patients and people come in for discounts. They come and ask discounts, or I am in the neighborhood, I am just leaving across the road, you must give some concession. Whenever they come to me, I can't say no, I do that. And apart from that, actually, whenever people need some support, a poor patient, I never turn down a patient for want of money. And but they mustn't at the same time exploit us also, and it is not always possible to offer. And those who cannot afford, you try and help them. There are a lot of people, like definitely you have a social responsibility to cater services to them also to the extent you can. That's what I believe in.
You've always been lauded for taking on inoperable surgeries.
Absolutely,
so
yes.
Why is it that you do that?
Because it's a challenge. Surgery is a passion for me. That's my meditation. Okay. I go to the temple very occasionally. Probably if I say seldom, it may not be right. This is my first temple, my operation theatre. That is all about it.
Tell us a bit about your upcoming book, The Making of a Surgeon.
Oh, right, yeah. This is something I always wanted to do quite some time. I am a person who believes in innovations. Even the traditional surgery you started first. The first person who did the first laparoscopic surgery is a French surgeon, Philippe Murray. Even the first surgery is an innovation of that particular person. So I always believe in innovations. Recently I had a talk for the surgeons conference. We're showing some innovations in surgery. And in the YouTube as well, I have put in some innovations in laparoscopic surgery, hernia surgery. So that way I'm a very aggressive person when it comes to surgery. I never say, I can't do this. If somebody says inoperable, I am very particular. I take it as a challenge and I start doing it. That is the way I started in the medical college when I was an assistant professor. After coming back from England in the early 80s. And we used to see quite a lot of cancer, cheek, tongue and all that. And those patients used to get a lot of lymph nodes in the neck. And some patients are turned down that saying that this is inoperable. What I used to do was I sit down, take my own time, dissect gently, softly, used to take it out. If somebody can take it out anywhere in the world, I'll also take it. That used to be my challenge. So surgery is a challenge. That's a passion. That's my meditation. That's all about
so your book
my book, yeah, every time what I find, I don't find time, but I don't know whether it is right to say I don't find time. I must find time. I mean, that is a book, Making of a Surgeon. Yeah. How you make a surgeon. Everybody cannot make a surgeon. Surgeon has to be committed. You must be skilled. You must have some talent. Otherwise, if you can pay money, you can get MS admission. That will not make you a surgeon. Okay. You have to be committed. So I wanted to tell them, how a surgeon should be to become a surgeon. Getting MS is only a license to practice in surgery. It takes several years. It takes at least 15 solid years for you to become independent. Say, I am all right today. From tomorrow onwards, I can operate on any patient, on any problem. That takes easily 15 solid years of hard work. So I wanted to tell this to the younger generation of surgeons who just after taking MS and MCS, they think they can do anything. They can't. They are not competent. So this is what I want to tell them. It is mostly for the upcoming young surgeons to know. That is that is the reason I wanted to write this book. Then I have a lot of innovations in surgery. That's also nobody knows about it unless I put it down. That's also another thing in the back of the mind when I am going to do it, and always you postpone things. And when it comes to, you have priorities. You go on working from morning till late. and it never works out. In our setup, unlike in the West, you don't have proper people to help you out. Okay. Writing books, journals and things like that. That's one of the problem, but I'm going to do that.
Yeah, this is. We would also like to know a little bit about your family.
My family consists of my wife Usha and 3 children, 2 daughters and a son. My eldest daughter is an MRCP. She is a physician practicing in England. Second daughter is an literature master degree in English literature, married to a radiologist from a late hospital. He is one of the partners of a late hospital, Trichur. And my son was not keen on medicine at all. He went to England in 2000. He spent 12-13 years. He did his master's. He did his MBA from Oxford last year. And I have asked him if at all possible to come and help me some point of time. Okay. That is about my family. Then I have 4 grandchildren. Oh. 2 of them are in England, 2 in Trichur.
Thank you, Doctor, for your very much, valuable time, and happy to have you on Rose Bowl. Thank you.
Thank you.